Okay, so what we're going to show you right now is what we call a braiding technique. I have 5 needles in line here, and then pretty much what you're going to want to do is meet in the middle of each one, just a little bit further ahead. Pop. And just to let you know, I did clean the area with alcohol rub, and I'm using my gloves. I'm giving it a little bit of a tap before I put the needle in. That kind of sometimes helps disperse the sensation of the needle. Sometimes you get people that are a little bit more tense. Now you can increase the intensity, I'm going to show you here in a second, by making all the needles closer together. Boom. And so what I would do from there is I'd put one here, one here, one here, one here, one here, and so on. This is mainly for big areas or large areas, like if it's a couple of different quad muscles. Next video I'm going to show you what we would do if it's like a distal rectus femoris type of a strain. Obviously this case we're actually going across part of the sartorius as well, but this is a 1-inch needle, so it'll get deep enough for all the quads. Okay, this is what I would call a little bit more of an intense braiding. Notice these needles are fairly close together, and then they kind of spread out a little bit further apart, so I'd say this is more intense because they're closer together. This is less intense. I'm going to use some of these needles here. These are sarin. These are 1/2 inch. Now the depth depends on what structures you're trying to get. If you feel like you've got to get all the way down into the bone because maybe you've got some adhesions or something like that, you might use a 2 to 3 inch needle until you feel the bone. So these needles here, they've got the little metal backings on them. That's what you can connect your electrodes to for your, if you have a TENS unit or an acupuncture TENS unit. So these here, you don't pull the little plastic piece out, you actually click them to the side, and then you put them in, and we're going to put them in relatively close to where we had them before. So I'm going to do my little tap, boom. And so now I'm closer together. These needles here, some people will do on themselves because they can easily maneuver them. Okay, so notice how close those are together. So here's a little bit less intense, so I'm going to spread it out. Okay, so this is an example. Okay, this is an example of increased intensity of the braiding, so I'm going to put this last one in here. And the key is here, just find the little area that clicks. There we go. Punch it in. And so that's an example of a higher intensity type of braiding. And remember, the reason why we do this is to increase the area of blood flow as much as possible, because remember, we don't know exactly how much around the needle that blood flow increases. Some people believe it's more peripheral, some people believe it's more local.